In today's Money Saving Monday, with the rising cost of healthcare, we're tackling ways to save at the doctor's office. As we near the end of the year, it's good to keep track of your spending against your annual deductible, which resets every year on January 1st. So we want to dive into how to save money when seeing your doctor. Joining me now is Dr. Natasha Bouillon with One Medical. Always great to have you
Great to see
here.
you, thanks.
Okay, so you're at the doctor's office. We're trying to save some money.
Right.
You have some great tips. First off, you say, try to skip the pricey labs.
Yeah, there's a couple of things you should ask your doctors to save money. One of them is ask your doctor if there's labs that you can skip. There's some labs like a vitamin D or even hormones that not everybody routinely needs, especially if they don't have symptoms. Another thing to ask your doctor is there a medication that you can stop taking? So in healthcare, we often start medications, but we don't often talk about when you should stop a medication.
Yeah.
And there are certain meds that you could taper and see if you can skip, and that saves you money. And this one's fun to ask about. Ask your doctor for letters of medical necessity. So if you have an FSA or HSA, there's a lot of things in there that are covered. So things like gym membership or even massages.
You're kidding.
Yes, even massage
Because
therapy.
we spend a fortune on gym memberships.
Exactly. So if they're medically indicated for your weight or your doctor's telling you to use it for your back pain, get that letter and those things can be covered.
That would be huge. And the massages?
I know, it's a great saver.
All right. Okay. Don't forget to ask. Okay. You should also ask if there are free services. Give us some examples of
Yeah, so with the Affordable Care Act, we're all entitled to certain free preventative services. So everyone knows about your annual wellness visit, so the physical exam, but there's actually much more. So people can get free labs, cholesterol check, blood sugar screening, even nutrition support, breastfeeding support, screening for mental health, which we were talking about.
We were just okay, yes, because you mentioned that was part of, the list of free services, depression screening. And I will tell you, this past year, when I went in for my annual, that was new to me.
Yeah.
I had to answer all these questions on the iPad.
About depression.
About depression.
Yeah, and look, what we're learning in the healthcare industry is we need to prioritize our mental health as much as our physical health. So even that annual physical, we call it now a wellness exam because it really encompasses all kinds of things, cancer screenings, vaccines, labs, so much more than just a physical. And you can save money by getting all of that care once a year.
And that's free. Okay, you even mentioned nutrition counseling.
Yeah, nutrition counseling. So I think we understand that, weight, nutrition, it's part of the Affordable Care Act. And so people can talk to their doctor about how to manage their nutrition and they can get some diet counseling in that visit.
Yeah, because sometimes, and I've gone down that route, with my family, to hire a nutritionist, that is expensive.
It can be really, really pricey if you're paying cash. And so
definitely.
that's great that it's covered.
Okay, and finally, can you negotiate medical costs?
Yes, so sometimes there's two ways we do this. So one is after the fact, when you get a medical bill, always ask for an itemized medical bill. And the reason why is that many medical bills contain errors. So you might be double charged for something. So it's good to look through that medical bill. And now before the fact, in some instances, if you pay cash or pay up front, you can negotiate costs, especially with procedures to lower those costs.
Oh, that is good. And how much could you be saving? Like, let's just say you wanted to pay cash. Is it like 10%?
It depends on, it really depends on the price. It could be 5 to 10%. And look, with those hospital bills and those ER bills,
that's a lot.
I've known people to save thousands of dollars by negotiating that bill.
Wow, that's amazing. All right, Dr. Natasha Bouillon, thank you so much. I know you're going to stay with us because we want to hear from you. If you have any questions that you want to ask our expert today, just text us 602-444-1212. Again, make sure to let us know who you are and where you're texting from, and we'll get your questions answered live on the air in just about 20 minutes.